During my residency, I found surgical pathology to be the most challenging discipline at first, and eventually I fell in love with it. I have heard from other people that they found Surg Path to be the hardest specialty when starting. I compiled this presentation to give you a basic outline of the specialty and some tips that will be useful when you are on your surgical pathology rotation. The intended audience is junior resident who are just starting their training. Frozen sections are a unique aspect of surgical pathology. I consider frozens to be one of the most exciting but demanding parts of surgical pathology. There is a patient under anesthesia waiting on the table for you to give their surgeon an answer. What you tell them can change the entire course of their treatment. That is a big responsibility and something that pathologists should be proud of. Frozen sections are a team effort. Many times, PAs will be on call with you as well, and they will notify you, or you may get a page directly from the OR. These are some of the steps of the process that need to take place for a frozen section, from receiving to cleaning up. And all of these are important. And if you miss any of these, you will not be very happy later on. Cleaning up after frozens is also very important because you want to leave the cryostat and the grossing area ready for the next frozen, whenever that may be. It is a professional thing to do, and the next person would definitely appreciate you. Usually, residents have access to the operating room schedule and can predict when a frozen will be sent. In Epic Beaker, there is a feature called Master Daily Schedule, which shows a list of all the planned surgeries and if the surgeon had asked for a frozen in advance. In CoPath, there is also something similar to the Master Daily Schedule. Another pro tip is to check with the ORs before leaving for the day. You don't want people calling or paging you once you're halfway home. Grossing is an important and critical part of surgical pathology. It is often underestimated, and many people do not like doing a lot of it either. Truth is that it does feel like grunt work at times, but let's be clear that without grossing, there is no surgical pathology. Here are a few tips for grossing effectively. Remember, effective grossing can make or break a case. Another useful tip when grossing cancer cases at least is to have synoptic report in mind, and that will help you so that you can focus on particular things in your specimen. Microscopy lays at the heart of surgical pathology. There is an entire language to describe what you see under a slide. I will address that in my video on pattern recognition. Meanwhile, let's talk about some microscopy tips and tricks that I have learned over the years doing surgical pathology. Before that, let me emphasize that you should learn how to use a microscope as soon as possible. How to get in focus, which hand to use the stage or the slide, which hand for fine focus, what does the condenser do. You should learn these things before you start looking at slides. Starting off, and I'm repeating myself here, these books will help you once you start looking at slides. Molavi is for absolute beginners. Biopsy books are good once you have a basic understanding of histology. And Kurt's notes, as well as the Search Path Review book, will be really helpful for upper levels when they're studying for board exams. Also, try and find if your attendings have study sets. Many people do, and those are very good cases to learn. When I was a resident on surgical pathology rotation, I used to bookmark a few web pages that I used frequently, and I'm going to share them with you. Firstly, PathLibre is useful for learning how to write a generic pathology report. If you are on a GU bench, Johns Hopkins prostate grading page will be helpful to you. For breast, Johns Hopkins has a page as well. I hope your program provides you access to ExpertPath and Immunoquery because these will be your best friends whenever you are on SearchPath. I have not mentioned pathology outlines here because almost everyone knows about it, and it is also a very useful tool. Now on to some tips. For every case that you look at under the microscope, there are a few must-know things. Your attendings will ask you about these things every time, and each of these will determine how a case is signed out. So be careful and try to look at these things before you show the case to your attending. This will come handy throughout your residency, not just on SearchPath. Communicate, communicate, communicate. This is a tip for incoming residents who are just starting to look at biopsies and they have upper levels available for them. As a surgical pathologist, you are responsible for answering questions from your clinical colleagues, and every biopsy is a question. This is something that flusters new residents when they start off a lot. It is natural for attendings to have different styles based on where they trained and how they were taught, so do not get frustrated with that. That's just my advice. And I know that you will learn this within a couple of months and you will be in tip-top shape. This is for upper level residents when a junior shows you a slide for your opinion. One of my mentors used to say, first you get good, then you get fast. So don't worry if it takes you an hour to gross a gallbladder or to look at a breast biopsy. Take your time, make your mistakes. This is a lifelong lesson. Diseases do not read books. So once you have found one diagnosis, always be on the lookout for another. In football, they say that a team is most vulnerable as soon as they have scored a goal. This is more for upper levels. As an incoming resident, I know that everything is new for you, so don't worry about making mistakes. But once you have gained experience, remember this advice. I have heard this being said by attendings many times, and it is good practice. What it means is that once you have a case, try to take it from start to finish. If you grossed it and saw the slides, fill in the synoptic, and if it requires, and if you can furnish a diagnosis, that's great. Follow the stains if they have been ordered, and keep the slides handy until the case is signed out. So you have full responsibility for the case. This is a tip for both junior levels and upper levels. I'm not going to explain this one. This is another one for junior residents. I think it's very important. This is some advice for junior residents. My favorite piece of advice that I was given, and I love to give, is when in doubt, please ask someone. And because a lot of times when we don't know something or we have like half cooked knowledge, then we tend to fudge, and that is not always beneficial for either for us or for our patients. This concludes my presentation. I hope you have a wonderful journey in the amazing world of surgical pathology and you end up loving it as much as I do.